If you spend any time at all in the health and fitness world online, you've definitely seen these three letters pop up everywhere: BPC. Today, we're going to break down exactly what BPC-157 is, what the actual science says about it, and why it's become one of the most talked about and controversial compounds out there. Okay, so let's just jump right in with the question that's driving this entire conversation. It's a question that doctors are hearing all the time now, from high-level executives with nagging shoulder pain to marathon runners with injuries that just won't seem to heal. You've heard the buzz online, you've seen the hype, and you want a straight answer. Well, that's exactly what we're here to do. All right, first up, the buzz. What exactly is this stuff that has everyone from biohackers to people with chronic pain so incredibly excited? Let's get a solid definition. So BPC-157 is a peptide, which is just a sciencey way of saying it's a small string of amino acids, like a tiny piece of a protein. Its full name is Body Protection Compound 157. Now, here's the cool part. Its original blueprint actually comes from a protein that's found in our own stomach acid. It was discovered way back in the 90s by researchers in Croatia who were just fascinated by the stomach's incredible ability to protect and heal itself. And in those early lab studies, what they found was pretty wild. This compound seemed to act like a bodyguard for tissues. It kicked wound healing into overdrive, and it could calm down inflammation like nobody's business. That impressive resume is exactly how it earned the name Body Protection Compound. Okay, so that's the promise. But here's where things get really, really interesting. There's this huge disconnect between that early promise and the actual hard proof we have for using it in humans. The difference is so big, it's almost hard to believe. So let's take a hard look at the data. The evidence from animal studies, it's genuinely impressive. I mean, we are talking about studies where rats with completely severed Achilles tendons, an injury that should take weeks and weeks to heal, were able to walk again in a fraction of the time. You see dozens of studies with results like this for everything from repairing the gut to even protecting the brain. But, and this is a huge but, the moment we switch from looking at rodents to looking at humans, that whole miracle cure story just hits a brick wall. All of that amazing animal research is up against just 3 tiny human studies. And the grand total of patients in those studies? About 30. That's it. That is simply nowhere near enough data to make any kind of medical recommendation. And this chart just says it all, doesn't it? I mean, look at that absolute mountain of research on animal models, and then look at that tiny little sliver of data we have for humans. That massive gap you see right there, that is the central problem with BPC-157 today. So, as you can probably guess, this giant evidence gap is exactly why the regulatory agencies have slammed on the brakes. In 2023, the U.S. Food and Drug Administration, the FDA, stepped in and officially assigned BPC-157 to something called Category 2. And this one little decision basically changed everything for people trying to get their hands on it. So what does Category 2 even mean? Well, the bottom line is this. It means that licensed compounding pharmacies, the special pharmacies that make custom medications, can no longer legally make BPC-157 for people, period. And the FDA was crystal clear about why. There's just not enough evidence that it's safe or that it even works. Plus, they flagged potential risks of your own immune system having a bad reaction to it. And hey, it's not just the FDA. The World Anti-Doping Agency has flat out banned it for all athletes, too. This official caution brings us to what is probably the most serious concern you'll find floating around online about BPC-157, a potential link to cancer. So let's really break this down from a medical perspective. Okay, the million-dollar question. Does this peptide cause cancer? The honest-to-goodness answer is we don't know for sure. But to really understand the risk, we have to look at the main way it's supposed to help the body heal in the first place. BPC-157 is really good at promoting a process called angiogenesis. Now, that sounds complicated, but all it means is the formation of new blood vessels. This is a totally normal, totally essential process. You get a deep cut, your body needs to build new little blood vessels to get healing supplies to the area. It's a good thing. But angiogenesis is a classic double-edged sword. While it's fantastic for healing that torn ligament, it is also the exact same mechanism that tumors use to grow and spread. See, a tumor can't get bigger without creating its own blood supply to feed itself. And the fear is that a compound that turbocharges blood vessel growth might accidentally feed dormant cancer cells that you don't even know you have. So the takeaway from an oncologist's point of view is this. No, There is no direct proof, no study out there that says BPC-157 causes cancer in humans. That study doesn't exist. However, the theory, the biological reason why it could, is plausible enough to make any doctor extremely cautious. All right, so beyond the theoretical risks inside your body, there is a much more immediate, much more practical danger that you have to know about. And it all boils down to one simple question. Where are people actually getting this stuff? Because licensed pharmacies are banned from making it, anyone buying BPC-157 is getting it from the gray market. Think unregulated websites that sell research chemicals. This is a massive, massive gamble. There is zero government oversight here. That means the vials could be contaminated with anything, the purity is a total question mark, and the dosage printed on the label could be completely made up. You are literally injecting a mystery substance into your body. So after we have looked at the hype, the science, the regulations, and all the risks, what's the final verdict? How should you actually think about BPC-157? The expert summary is really balanced and clear, and it comes down to 3 key points. First, it is promising. The animal data is compelling and the biological mechanism makes sense. Second, it's completely unproven in humans. We just do not have the safety trials we need for any kind of medical confidence. And third, it carries very real risk, both that theoretical cancer risk we talked about and the very immediate practical risk of product purity. But here's the really good news. You're not out of options. For the exact same goals people are chasing with BPC-157, like healing joints or fixing gut health, there are proven, safe, and regulated medical alternatives available right now. We're talking about treatments like platelet-rich plasma or functional gut protocols. These are things you can talk to your doctor about today. Which really leaves us with the one final question. After everything we've looked at, you have to ask yourself, is the potential promise of this compound worth all of the known and unknown risks? And honestly, that's not a question you should answer based on something you saw online. It is a serious conversation that you need to have with your own physician.